to begin our webinar for today, Environmental Health, Environmental Violence, and the Rights of Indigenous Peoples in the time of COVID-19. My name is Roberto Mucaro Borrero, and I'm going to be moderating the webinar today. And we have a number of great guests, speakers, presenters, and we'll be going in order as per the flyer and the information that we have sent out. But before we begin, I just want to go over some logistics so that we can all be on the same page with regard to how you work this webinar. And I'm going to share a screen that so that as everyone is signing on, they'll be able to understand how this works and how to hear the interpretation, because we will have some of the presenters presenting in Spanish today. So I'm going to try to share my screen right now. Let's see here. Okay, so if you see this screen here, we have an interpretation icon that's at the bottom right of your screen. You can see that here. It looks like a little globe. What you need to do is, for those needing English, you select English, and then you will select mute original audio. So here's what the image should look like. Connect to English, and then you want to hit this here, mute original audio. So for the presenters, just mute the microphone using the microphone icon at the bottom left of your screen. You'll see that here. And for those who are attending, any questions or comments that you have during the presentations, you can just use the chat icon, and then either myself or someone else will respond or will share that information with the speakers. So now, if you'll allow me some patience, a little bit more of your patience, I'll just go over to the Spanish instructions. Bienvenidos a todos, para los que están participando y necesitan traducción, interpretación en español. Primero, localice el icono de interpretación que está en la parte inferior derecha de su pantalla, y aquí es la imagen. Tú puedes ver el globo aquí. Después de eso, seleccione Spanish o español. Seleccione Mute Original Audio, que es apaga el audio original. Y esto es muy importante, porque si no, ustedes van a escuchar los dos idiomas en el mismo vez. So aquí es la imagen. Tú puedes ver Spanish, español, y aquí Mute Original Audio. Y durante el seminario web, si ustedes quieren comunicar conmigo o alguno de los presentadores, por favor, puede comunicarse en español usando el icono chat. Y aquí, en el parte inferior de su pantalla, tú puedes ver el icono de chat aquí. Ok. So, ahora voy a hablar en inglés otra vez. Okay, so thank you for that patience. And I'm going to turn this over to our first presenter, Andrea Carmen, who's the Executive Director of the International Indian Treaty Council. And she's going to share a little bit about the webinar's theme today, so that you can understand where Treaty Council is coming from when we use terms such as environmental violence, environmental health. Andrea, you have the floor.
Respectful greetings to all my relatives. It's an honor for International Indian Treaty Council to invite this distinguished lineup of speakers and panelists to share the issues that are impacting their own nations and communities. I just wanted to give a little bit of background on what we mean as International Indian Treaty Council by the words we're using, environmental health and environmental violence. And it's very important to recognize that these concerns that have expanded the understanding of the international human rights arena came out of work with grassroots Indigenous peoples, especially Indigenous women. And when we look at the UN Declaration on the Rights of Indigenous Peoples, Article 29, which is an article I think that Indigenous peoples don't pay enough attention to, we see that we have the right to free prior informed consent before hazardous materials are utilized or dumped in our territories. And that includes mining, nuclear waste, many, many different forms of environmental violence that are taking place. But in our case, we began this work looking at the impacts of toxic pesticides in our Yaqui communities in northern Mexico, in Sonora and Rio Yaqui, Sonora Mexico, causing many, many birth defects and reproductive system cancers, breast cancer in teenagers, really quite a horrific situation impacting the reproductive health of Yaqui Indigenous women. This is a workshop that we had informing the women of different ages in our communities, not only about the impacts of these pesticides with the airplanes flying over the communities, but also their rights to free prior informed consent. There's a way to move this. I'm trying to move the screen, but I'll go ahead and just mention that the UN Declaration also protects the rights of Indigenous women and girls in particular, to ensure that women and children have full protection and are protected from violence of any kind. And the reason that we ended up using the word environmental violence is because we found out that a lot of the pesticides being used in Rio Yaqui on our communities without any protection, any warning, any care for the community members, and especially the women and children, were deliberately being used, even though they've been banned by the exporting countries, which included Germany, Bayer, Crop Science, Switzerland, and especially the United States, the infamous Monsanto. That these chemicals were well known to be so dangerous that they caused death, they caused cancer, birth defects especially. So the companies decided the liability was too great for them to use them in the United States. They prohibited their use, but they still exported them. So when we began to bring Indigenous women together to talk about these issues, this is the second International Indigenous Women's Environmental Health and Reproductive Health Symposium, looking at the impacts of toxic contaminants. The women who range from traditional healers in their 80s and 90s to young Indigenous delegates of even 12 years old, they decided that they wanted to call this environmental violence because it's intentional, it causes suffering, death, extreme impacts, and it's known to those that are perpetuating these practices. So the terminology had never been used before. And we took it to the United Nations Permanent Forum on Indigenous Issues, to the World Conference on Indigenous Women, and the terminology was accepted at the United Nations, the new human rights term or definition of environmental violence. In addition, looking at environmental health as the connection between human and community health, all forms of health with contaminants in the environment. We actually took a case on these pesticide imports into Mexico to the UN Committee on the Rights of the Child. This is our delegation from our Yaqui communities in 2015. And for the first time, this legally binding treaty body, the Committee on the Rights of the Child, adopted and accepted the term environmental health as a term that is accepted and protected by legally binding conventions of the United Nations. And ever since then, they've been utilizing this term to analyze the behavior of countries and the impact, especially on children and maternal health. So it's important not only to look at the way we're defining and understanding these issues, but understand that we have the power of Indigenous peoples to expand the way that these rights are looked at and the violations of rights represented by environmental violence, which also now we've been able to expand to look at the impacts of mining, extractive industries, and sexual violence and sexual exploitation of Indigenous women and girls in those communities, the man camps they refer to. So I just wanted to bring up that context and just make it clear that this terminology was based on rights of Indigenous peoples, but also concerns of Indigenous women and community members as a whole that we've taken internationally and had recognized from our perspective of working in the human rights arena. So with that, and that brief definition of the terms we're looking at here, I'd like to turn it back to introduce our distinguished panel. Thank you.
Thank you, Andrea. For folks who are just tuning in, that was Andrea Carmen, the Executive Director of the International Indian Treaty Council. And I'll just say, Taigwe ituno kena atiaono, greetings brothers and sisters, diri mukaro agwebana, boriken taino daka. So my name is Roberto Borrero. I'm from the Taino Nation, from the island of Boriken, the Guainia tribe, also president of the United Confederation of Taino People. For folks who are just tuning in, we want to remind you that there is an interpretation icon at the bottom right of your screen. Right there, you'll have two choices, English and Spanish. You should click on English, and then what you need to do is to mute the original audio. This is very important because if you don't mute the original audio, you will hear also the Spanish translation. We will have Spanish speakers today. So this is the way that you won't get both of those channels in at the same time. So again, this is the same for those who are coming in Spanish. Right now, we're going to go to our next distinguished speaker. On our information that we sent out to advertise this event, we had said that President of the Oglala Lakota Nation will be giving an update on the tribal nations checkpoints in South Dakota, USA. Chairman Barroner could not make it due to an emergency meeting, and so we have spokesperson Chase Iron Eyes, who will be giving a statement on behalf of Chairman Barroner. So Chase.
Thank you, brother, and thank you to everyone who is on the call and giving their time and energy in this this very grave hour. We're all collectively experiencing the dread, the existential dread. But I want to read a letter from our president here at the, well, in the federal system, it's called the Oglala Sioux Tribe. We call ourselves the Oglala Lakota Nation. But President Julian Barroner is our second youngest president in history, in our history. And his letter, I'm going to read an excerpt from it that hopefully has been translated. Sorry I was a little late, but here it goes. Now he's talking to South Dakota's Governor Kristi Noem. South Dakota is an invasive colonial settler state. that is probably 90%, yeah, maybe 90%, 85% Caucasian, European American. And they are in illegal occupation and illegal annexation of our lands, all of our countries and our homelands. They're able to prop this up with lies and violence. But here's his letter to Governor Kristi Noem. Now you are threatening to dismantle checkpoints that my tribal nation has erected in the interest of protecting our community. At some point, the question must be asked, is your dominant concern the health and safety of South Dakotans or the commerce of business owners who use public highways in our state, many of whom do not even live within South Dakota? It should come as no surprise that we consider the profits of people living outside of the boundaries of our tribal nation of little importance at this critical moment, as compared to the lives of our people. And we are appalled that you would not only fail to protect your constituents' health, but also forcibly intrude on whatever small steps we might take as Native nations to follow science and exercise caution during this once-in-a-lifetime pandemic. I will do my best to continue working diplomatically with you, but I cannot guarantee that my people will permit cooperation if you choose to follow through on your ultimatum. We have endured generations of broken treaties and orchestrated disadvantage, and we have our limits. The entire world now faces an existential threat. More than ever, the posturing of politicians must be set aside to make room for sound public health policy. We, as a nation of some 100,000 people, 30,000 of which live on the Pine Ridge Reservation, are doing our best to hold it all together. And we hope that you would reconsider your purpose and intent in bringing another version of smallpox to Indigenous children. Nake Nula wa Ualo, Malakota, Julian Bear Runner, President of the Oglala Sioux Tribe. That was our president, and as you well know, what we are witnessing on the Pine Ridge Reservation, on the Cheyenne River Reservation, is whenever Indigenous peoples step outside of the confines of the shock fence. You know, when you have a dog and you have a shock fence around it, and if it drinks the water and eats the food, it's okay. But if it steps outside of that shock boundary, immediately a shock is executed on that dog. That is what my life is like. That is what all Indigenous peoples' life is like. So when we protected our community simply by putting up checkpoints, like the Maori in Aotearoa, everywhere else, Indigenous nations are protecting themselves. And the entire globe will live with us, will love with us, and will die with us. Indigenous nations are expressive of the state of natural order. So when we take a look at colonialism in what is called the Americas, and specifically the United States and Canada, have executed, and even in what they call South America and Abya Yala, 200 to 300 plans to bring about our extinction. It starts with blood quantum and it ends with disestablishment. And if we go outside of our shock area, our area of confinement, which is what we call the Pine Ridge Reservation, prisoner of war camp number 344, and the fact that the governor of an invasive colonial state and a colonial project country like the United States, whose only right whatsoever And Americans know this. Americans do not want to be the terrorists anymore. I don't want that anymore as an American, as an original sovereign of this hemisphere. Americans must honor our treaties so that they can have a valid identity and claim to continuing to live in our hemisphere. It is possible. I believe that most people are able to be awakened. Indigenous peoples, by our very lives and actions, are giving authorization to our brothers and sisters all over the world to begin to liberate themselves spiritually from the programming, the virus of the English thinking or colonial thinking universe. There's a dissonance there, a metaphysical dissonance that we have to appreciate and that we have to deconstruct and liberate from, so that indigenous dignity can lead these colonial countries and offer a path to redemption and salvation to those who have rivers of blood on their hands, and to those who in their institutions, even their Pope, wants redemption and salvation. And we have to do our part to meet them in a diplomatic fashion, but their institutions must understand that we will stand and we cannot back down. It's a matter of life and death. Do we want to die from another colonial foreign disease? Or do we want to die from the military security state coming to force us to open our borders, like at Standing Rock? Mitakuye, I want to thank you for listening and allowing me to step in the stead of our president, Julian Bear Runner, and the Oglala people and the Lakota Nation, also known as the Sioux Nation, stands with all of our indigenous brothers and sisters. This is our entire planet, and it's time for us to lead. It's time for us to heal. Thank you.
Brother Chase, for sharing that message of President Bear Runner with us, and for your follow-up commentary. For those who are wondering about the statement, it will be posted at the IITC website under our webinar section today. So after this webinar concludes, please check out the IITC website. Go to the online seminar section, and you will see a list of names of all the presenters and their contact information, as well as some of the information that they have shared here. So with that, I want to move on to our next panelist, and I have the great honor to introduce our new United Nations Special Rapporteur on the Rights of Indigenous Peoples, Francisco Cali-Tsai, who will be talking about the questionnaire, a new questionnaire that's out from his office on the impacts of COVID-19 on the rights of Indigenous peoples. So with that, I turn it over to Francisco. We're very thankful to have you today. Francisco, you have the floor.
Good morning, everyone, brothers, sisters, who have given your time to be here with us and to participate in this webinar. As all of you know, all regions of the world have been impacted by COVID-19, and indigenous peoples have been those that have been severely affected by this pandemic. This has compelled government entities to adopt extraordinary measures to prevent the expansion and the consequences that come with the pandemic. The quarantines, all the health controls, without a doubt, are necessary. And besides, it's everyone's responsibility to make sure that they are complied with. But we need to be clear that such measures should not at any point or relativize or disappear or authorize or ignore any rights of indigenous peoples that are wholly theirs. All of these measures, the quarantines, all the different conventions on discrimination against people, the ones based on tribal peoples, the Declaration of the UN on the Rights of Indigenous Peoples, and all other international instruments that states have signed and in which they have committed that they are going to protect and respect indigenous peoples and their communities are in place. They remain in force. So with all the information that I have received in our office, I mean, I'm talking about all this information, everything that I've been bringing together hits everyone who sees this hard. And it's clear in this message that indigenous peoples are the ones that are getting a major blow by this pandemic, but they're also the ones that are least likely to receive support from the government, from the states. And that's historically because indigenous peoples have been the ones that have not received attention from the state. They only receive attention when they're interested in our natural resources of our lands and territories. And now we see the consequence of that. I know we have heard this before. Nevertheless, what's happening now, it's the same thing that happened 500 years ago or 500 years ago when the first Europeans arrived in our lands. Indigenous peoples were the ones that had the least immunological defense to these new illnesses, mainly because of the dire poverty in which they live, and also because they were not in contact with other people, with foreigners, let's say. Therefore, their immunological system was not ready to affront this sort of illnesses or diseases, which is why my office has decided to conduct a study on this issue, one that is going to be submitted to the General Assembly in October, which is based more so on questions which will cover issues such as the incidence of mortality rate and the increase of infection among our communities. Are there disparities, obstacles in terms of medical attention, health attention to water access, health, public services, and services that are culturally appropriate to the individuals? Are indigenous peoples participants in the creation of measures to counteract this pandemic? And how about the application of the groups or the actual implementation of this on indigenous territories? About quarantines and closures and other measures, how do they affect the food issue? Language, are the information conveyed in the appropriate languages in terms of women, the children, the disabled, in terms of are they receiving the information and are their issues being addressed? So all these other policies, confinements and pandemics and so forth, and what's the effect of them, the effect of measures in terms or in relation to the territories, to the appropriation that may take place, and taxes that are assessed also to the lands and indigenous peoples because of COVID-19. How about communities that are in voluntary isolation? Their healing system, their traditional system when applied to some of these measures. So all these are different issues that I will be touching upon. and questions in terms of how this information is brought together, how the governments analyze information related to COVID-19, as well as including what specific measures are being adopted to avoid and to make sure that the rights are not infringed upon our rights. And again, for women, children, the elders, people with disabilities. So 11 questions is what this will be comprised of. But I'd say they will have sub-questions, which will make this questionnaire more concrete, more specific. So I ask all of you, brothers and sisters, to please support this effort and send in or submit your answers to the email that has been mentioned or has been included and will also be shared at the end of the presentation. Because it is important for states to know that us, as UN Special Rapporteurs, as independent bodies, are watching the way in which the states are treating indigenous peoples through this crisis. Thank you very much. Thank you very much to IITC for the invitation, for allowing us to share this campaign that we're pushing forth as a new special rapporteur on the indigenous peoples of the UN, and I hope to have your support. Thank you very much.
Thank you, Jajom Atiao. Thank you, brother Francisco, for sharing that information. Once again, just to remind folks that at the IITC website, we do have links available to the questionnaire that Francisco was just speaking about, as well as contact information, so that if you would like to follow up with the UN Special Rapporteur on the rights of indigenous peoples, you will be able to. I now have the great pleasure of introducing our next speaker, was also my tribal sister, Tai Pelly, who is the International Relations and Human Rights Officer for the United Confederation of Taino People, representing the Caribbean region. Tai, welcome. Mabuika, Itu, and you have the floor.
Thank you very much. For me, it's really important to speak to you today, just to give you a vision, an idea of what the Taino people are going through during this pandemic, and the environmental violence has been continuous, especially because of colonization. If Chris could do me the favor and please show the first slide, because I really want you to know, to see and to know as the Taino people of the Caribbean. First of all, a child who speaks Spanish. It's Latin America. Those of you that know, it's Latin America and the Caribbean. So I can't emphasize it sufficiently how important that is for us, because we have been under the pause of the United States. We have been forgotten. And we need to start remembering these things as Indigenous people. We need to remember our roots. So if you see here, you see this image of one of our sisters, Nico Bonet. Everything that the Boriquen people have gone through, not just the historic part, but recently, even before we talk about COVID-19, we have to go to where was Puerto Rico before all this got started. First of all, I want to remind you, if we can go on to the second slide, that flower is a very important flower, has a lot of meaning for us. And I want to express something that's really important here. We are the first Indigenous peoples that were displaced. We were evicted from our lands. we have a diaspora of people from the island of Boriquín, and there are more people out of the island of Boriquín than living on the island. So we have 3 million people on the island, but I showed this slide to show you how we live. You can see the combination of races in, I don't see the full image here, but you can see the one that has the clock, the watch, and then the tattoo. Those are Taino people's symbols. In 2007, we were affected by the Irma and Maria hurricanes, and part of that environmental violence has to do with climate change, and as a consequence, we are being affected with hurricanes and others weather problems. We had hurricanes that were at category 5, and I'm sure you heard about what happened during that time. And I show you this slide. I want you to see that even though we're not on the news, we still have people. We have people right now in May of 2020 that are still suffering the consequences of what happened in 2017. And still the federal government doesn't consider us in one way or another, doesn't even pay attention to us. And so therefore, is being, the government is completely ignoring us and do not give us the support that we need. And so then Chris, can you go on to the next slide? It's a collage. In December of 2017, after having removed the governor because of the corruption that he was involved in, at the end of December, Puerto Rico, Boriquén, the island of Boriquén, it's as Puerto Rico, and we started to have earthquakes. We're accustomed to it, but what happens here is that those were minimized. There was a huge earthquake the 6th of January, and it's estimated that that was the biggest one, and there was even a stronger one the next day, and homes, schools have been destroyed. And during that time period, our people found out that, you see those bottles of water in this collage right there with the machete, which is our flag. We found out that there was supplies when more than 4,000 people died during the hurricane, even though we had all these supplies available to us, but they weren't made available to us. And then with the coronavirus in Puerto Rico, the first case was found out on March 8th, then on March 15th, and now it's been 2 months that Puerto Rico has been in quarantine, but unfortunately people were still let in. People came in on boats, on ships, during tourism, and so that has affected our people greatly. And of course, our communities, our indigenous communities, as Pancho said, they're the ones that have the least amount of protection. And the 26 municipalities, there's only 2 that have not had COVID cases confirmed. The island was not ready. The earth keeps shaking. On the 5th of May, we had stronger earthquakes. During this time that we are under quarantine, as Andrea mentioned, it's affecting us so much because the environmental pollution is accumulating, and cancer is even getting worse. And the corporations, because they have the support of the American government, they are getting away with what they want to do. They've even want to do mining exploration during this time period. So they're threatening us. When we talk about the objectives of sustainable development, we also find out that the oil companies, they want to come into our island and they want to affect our environmental health and the health of our people, especially affects our women. Now, the carbon ash that many of you know about, even though that there was always an agreement that there was not going to be deposited in the island, we still have these huge mountains of ash that many of you have seen. And our people is being affected more and more by this environmental pollution, especially children that have this kind of child of cancer, like children have leukemia. Other people have stomach cancer. We're being affected terribly. If we could go to the next slide, I want you to look at Chris Mukado. Can you please go to the next slide, please? This came out day before yesterday. So what do you see here? You can tell that there's the racism for our indigenous people and the Afro descendants. The person that is represented is the white person, the boy is a blonde boy, and he's saying avoid contact with people who are ill. And isn't it strange that the person that's sick is a person that is a Black person? And between today and tomorrow, perhaps we're protesting this and the government will become aware of this, but look, it's a woman on top of it all. They put her with a Black person and they put her under the category of a sick person. So for us, as Indigenous peoples and the Afro descendants, we are against this type of promotion that has a message of racism behind it, even when the woman is the one that carries the worst burden of what is environmental violence. And then now to my final slide, as Indigenous peoples, the next image, please. As Indigenous peoples, we have been under subjugation under 527 years. But we've been saying during this time, we are alive, we are here. One of our Taino sisters painted this, and there's a great story behind this image, but first they try one way, then they try another way. They tried to change this painting to make her shut up and not to present Columbus or colonization this way. These are all the branches of Indigenous peoples, our rights as women, how we've been affected by colonization. And as our brother Chase was saying, we are now taking the reins of our future, of our destiny, and we are promoting food sovereignty. We have a lot of young people that are working on agricultural development at big and small scale. We are here to continue and to fight. And I also encourage all of you for the next Monday or next Friday from 5 to 7, we're going to have a webinar. The Bodiken people, the Taino people, Hori, all of you are invited, where we're going to talk about food sovereignty during the time of COVID-19. And then the hurricane that's coming up, the hurricane season that's coming up. But I want to say thank you very much. We continue to raise awareness. What's going on, especially as Andrea mentioned, violence to our health and to the environment, and how it's affecting especially our women, our communities, and how it is a responsibility that each one of us have is to defend and make our rights be heard. Thank you very much.
Homely too. Thank you, sister, for that presentation. And I want to introduce our next speaker. I have the pleasure to introduce Tylee Terena, who is on the line from Brazil. Tylee, You have the floor.
Good day. Thank you very much for introducing me. And thank you all, those of you that are participating in this panel. It's such an important matter that we are addressing. And we've been talking about this for such a long time. This is environmental violence. And I believe all of us on the panel, we need to be reflecting on this and the issues that we are going through at this time. And as Roberto said, I'm from Tylee and I'm from Brazil. And I wanted to share with you a little bit of the reality of what we're going through in Brazil. And then maybe Chris, maybe if you could show my slide, please. Thank you very much. Okay, so just a little bit. I don't know if all of you have been following what's going on in the political area, but our President Bolsonaro, he doesn't believe in the pandemic. So this has caused a lot of problems for our Indigenous peoples, first of all, because we don't get supplies, we don't get access to hospitals, we don't get the basic health needs so we can get the necessary medical attention for this pandemic. And then throughout Brazil, not only are Indigenous peoples being affected, but all of us are being affected because of the irresponsibility of the government. And we, in Brazil, we have the highest amount of COVID cases because they're not recognizing our cases. Not everybody's being tested for COVID-19. So today, here that you can see on this map, these are the data. It was 13,000 people that have had cases, and people that 106 in Latin America, and then Brazil, 14,000 dead, Mexico, Ecuador, and then Peru. And besides Mexico, Brazil has the greatest amount of cases in the Amazon region. I am from the Chaco area in the southern part of Brazil, and we still do not, God, we don't have any cases of COVID, but at the Amazon region, they do. You can see all these red areas of the Indigenous peoples that have the healthcare systems of the government. And these are where the arrows where they have the most amount of cases where they are infected. And I'll share with you a little bit about the sub-notification and non-recognition. This is the investigation of Indigenous cases. They only consider that 19 people have been affected, but we have more than 78 cases, even though the government only recognizes 19. And also the non-recognition of an Indigenous identity. And as Andrea started to talk about a little bit about the Declaration of the United Nations on our fundamental rights of the right to identity as Indigenous peoples. And we see that we have a huge problem here in government with the Brazilian government. They refuse to recognize us as when we want to recognize ourselves. You can only be recognized Indigenous if you live as in a traditional community. If you've already migrated to the city, because you won't be using the community systems, then you are not recognized as Indigenous person. We have more than 34 nations that have shown they have cases of COVID, and this that Francisco was talking about, the people in isolation. We have a great concern with our brothers who are in isolation. But we are fearful because the government is now giving incentives for these people to have contact with different projects that they do not want to have contact with. There's different laws. We need to be talking about our rights without, they're coming into our lands without our consultation. There's 2 projects that are now
We lost the translator's audio.
Okay, and sorry. So this is about a mining project in Brazil. It's a proposal, and I apologize because I was hearing both languages for a moment there. So one is about mining, which authorizes this operation without the consent of indigenous peoples therein. Another one is related to territorial fraud. I'm not sure what the translation into Spanish would be, but this is about authorizing invasions within indigenous territories. Fortunately, or I'm not sure, in these last years, we had the first indigenous person who was elected to Congress, and with the work that she has been doing in this public space, she has been able to help in terms of the rights of indigenous people, and they're working on a bill to support further our indigenous peoples in managing issues such as transportation, or as you know, the Amazon region, indigenous peoples are the most affected. So they are very isolated from basic needs or service institutions. So the idea is to have better transportation and communication with them, but also better access to health services for the indigenous, both in those areas as well as indigenous peoples in urban centers. So the idea is for this emergency support to include also the delivery of basic material, food for our isolated brothers, those in their communities that are not as related to the cities, but also for the brothers who weren't able to go back to their community. See, I would like to be in my community right now, but when the pandemic hit here in Brazil, they shut down all the communities so that no one from the outside can go in and take the virus with them. So they are not allowing anyone else to go in now. So this is my case now. I'm stuck in the city, but I should be there with my community. I also wanted to say, and I know that I'm running out of time, is that we have government entities such as the FUNAI. They're part of the Department of Justice. They are responsible of the demarcation of territories. But since they are part of the government, though, they are aligned with Bolsonaro's platform. So we have some in the FUNAI, and we have an evangelical person who's also trying to legalize some of these practices. And we also have one of our own initiatives that we're trying to push forward. Because us, as indigenous peoples, are facing a situation that we expected. Because for years, our prior leaders have known that we need to change the way that things have been. the way that the humanity has been carrying itself out, particularly in the urban centers. But the idea is for us to think as a whole, as everyone being one. So that's why we started focusing on our own autonomy and finding our own funding for different projects in our communities. And also to take back our own activities, not just in Brazil, but in the rest of Latin America and in our broader space for youth, for women, in which I also participate. So the idea is how we as indigenous peoples are participating within society at large. And when we come in, how are our voices heard? Because we depend nowadays on this capitalist system. I mean, we cannot have this false expectation that because we have our traditional ways that we wouldn't be hit by these foreign things. But the pandemic is an example of that we're not immune. Thus, we have to take back our communities. We have to take back our livelihoods, mainly because us, well, in our case specific, as youth, we analyze all of this and we look at this and we think that we are stuck with practices that don't belong to us, that don't allow us to change, don't allow us to growth. So when I hear others, okay, when we get back to normal, but you know, the normal does not exist. So we have to think is when all of this passes, where would indigenous peoples and our voices be said or established or located now? So in terms of this pandemic now, with it, we can see that our planet breathing. So that's positive about that. So again, we need to think about a role with all of this, that is not for just for us to be working with each other. No, we need to be working with north-south relations. We need to think with Europe, in how we can strengthen our voices with non-indigenous that are also close to us, because we're going to be going through all of this and we're going to have to go through all of it together. You know, it's not a matter of selecting people. So Mother Nature sees us all as one, right? And that's all. Thank you very much. Thank you for listening. And I would like to share just very lastly this picture of our brothers protesting in the Amazon region. Yes, this is about how indigenous peoples are asking for help. So that's it, brothers, sisters. Thank you very much.
Thank you very much, Tylee Terena from the Terena Nation, representing the National Council on Indigenous Women of Brazil. Our next speaker is coming from Africa, tuning in from Africa. We have the pleasure to introduce Lucy Mulenke. She's a Maasai, the Executive Director of the Indigenous Information Network in Kenya. Lucy, you have the floor.
Thank you very much, Roberto, and thank you very much, everyone. It was very interesting to listen to all the other presentations. And what I'll do, because I've been, given about 5 minutes, and then in the later programming, we'll also be there to speak about the women and children and other issues that are coming up. But I want to actually go back and a little bit touch on what the special rapporteur has said, because this information that he requested and was talking about is very, very crucial. And this is something that is really affecting us in Africa. We've seen the COVID come and our indigenous communities have been impacted a lot because, as you know, most of the indigenous communities in Africa are pastoralists, nomadic pastoralists. We have agro-pastoralists also, hunter-gatherers, and other minorities who live in remote areas. And we thank God that we have not had very many cases that these communities have been, being affected by, or rather they've had COVID, except 1 or 2 in other different countries. And this has worried us that if this disease reaches there, then there will be quite some crisis. Why the crisis is simply because we know that those same communities, governments really don't take serious attention about them. People hardly reach them and so on. And what we have seen is that we have seen a lot of impact in the last few months. There have been a lot of environmental problems within some of the countries. Like we've had lots of rains that have caused floods, landslides, and even some of the communities losing their lives, and some of them are already, displaced in their own country. This is very crucial because when they are displaced and they are staying in displaced tents and structures which are not very safe, you cannot be able to prevent them from different impacts that can come along. As they say, keep distance, wash your hands, do ABCD, you must keep yourself clean and put your masks and so on. And some of those are just but stories for indigenous communities. We know also some of those these remote communities are not able even to access things like the masks and so on in Africa. One of the biggest challenge that we have also noticed is the issue of the conflict arising, internal conflict, tribal conflicts within different countries. We have, like, for example, in Cameroon, they've had quite some conflicts for some time. And suddenly in the last month, we had a serious conflict that affected some of the women and children and displaced them, and now they are living in camps. And considering that the Mbororo community, most of them are Muslims, and so being at this time of Ramadan is very, very challenging for them to be displaced and having a lot of problems staying in the IDP camps. We've also had problems in Mali. And I think that the Mali and among the Tuareg and others has been really a very bad conflict that has displaced them also and put them in conflict within the IDP camps. In Kenya, we had a few tribal conflicts also, some of them all related. Actually, all these conflicts, the rapporteur should know, and I'm sure he's really aware, are all related to issues of land. And it has become a big problem because these land land conflict has been quite a pain in the neck for all the communities, especially the indigenous communities. When there's prolonged drought, there's always that problem of conflict among the tribes, competing of natural resources or productive resources, and many people lose their lives. Some of them is just the usual trying to get which land belongs to us, where is our borderline, and so on. I think we really need to have the governments take this issue seriously. And it is something that has really touched many of us. And we think that as the special rapporteur has brought up that questionnaire, we need to have him, as soon as the report is compiled, to have this followed up in different countries and in different governments. And you have clearly put that some of the governments have actually signed most of those instruments, but there's no action that has been taking place. Even those who have taken cases of land issues and conflict into to high court, to different courts in the countries, the issues have not been taken very seriously. They have not been completed, and they have not even been able to have clear satisfaction for the communities. So there's still that conflict and that uncertainty among the indigenous communities, and all that affects their health. It also affects the food production, and it affects even the learning system. Right now, even though we are going to talk about issues of the impact of COVID with women and children, we know, like some of the countries, all the schools are closed, they're at home. And when they're at home, there is even more conflict within the families. And there's also a lot of problems, because this is a life which the communities are now told to lead. They are told to keep only to their own space and not even move from one place to the other. And that is the life they have always been used to. It becomes very problematic for them. Even when it comes to food production, it has also gone down. And we are even fearing that because of the way some of the countries have blocked people movement, the shortage of food is also going to cause a lot of problem for the indigenous communities, and it has actually caused in some areas because nobody can reach them, and they cannot also come to the towns because there are restrictions that they cannot move, they cannot go without any masks on their wherever, and so on. So these are some of the challenges that they are facing. And when I talked about conflict, it's not only the countries that I've mentioned, there are many more. Recently, just this same 2 weeks ago, or even within 1 week, we had some conflict also arising in Sudan. And we have different communities who have been living together peacefully, and then suddenly this erupts. Is it because of COVID-19? Maybe because people are idle and every small thing triggers, because also they don't get the usual services that they are able to get. We have seen also because of all that, the communities are also fearing to get into the hospitals, even though those services, some of them are not nearby. And so they even now decide to stay at home. And that's the fear also. Will they get enough medicine? The traditional medicine, will it be the correct one that they'll be given? Will they be healthy? Will they be able to move on and be able to open up? I like the way one of the presenters, I think it was Terana, who said that it's not going to be a new, let's wait and then life will be the same. It will never be the same again. We see a lot of problems that are coming up there. And so we must be prepared. I think we must really look at how we can be able to see how we can bring back our communities to have confidence among themselves and to be able to live in a way that they can. And also for the government to change their systems. I think this is the high time that we need to have the governments really taken into task to say what they have done for these indigenous communities. If you are signing to the international instruments, have you taken attention to make sure that indigenous people are really taken care of? Have they been given the services? You tell them to wash their hands. Is that what available? Is it available for them? Some of them have still to walk far away. So there are quite a number of issues that are really very critical. And I thought that it's very important to bring them up quickly so that we can be able to discuss. And I'm sure many of my colleagues are also listening, and they can write in their chat and bring up these questions. And I want to promise a special rapporteur that will try as much as possible to make sure that the questionnaire has been distributed along and people are sending back their answers and giving different thoughts of the way the questions will be asked so that we can be able to be helped and work further to see how we can have our communities get back their life. I think I'll stop there and then I'll be able to continue. And thank you very much for giving me this opportunity, and I hope to get into the other discussions later. Thank you.
Thank you very much, Lucy. Lucy Mulenke, calling in from Kenya. Our next speaker is Manny Pino, Acoma Pueblo, Laguna Acoma Coalition for a Safe Environment, and the Indigenous Environmental Network. Manny, good to see you. You have the floor.
Good morning, brothers and sisters. I'd like to thank the International Indian Treaty Council for giving me this time to address the environmental violence and health impacts in correlation to this pandemic and overall environmental impacts as well. My focal point is going to be the Southwest, where I live. I am from Acoma Pueblo in New Mexico. Like many other Indian nations, we are disproportionately impacted. Also, I live in Arizona, and as many of you may have read, the Navajo Nation per capita after New York and New Jersey is the most impacted population in the United States. This morning, I would like to draw correlations to the COVID-19 pandemic and extractive industries in the Southwest. The correlation being underlying health conditions that existed prior to COVID-19. For over 70 years in the American Southwest, we have been confronted by uranium mining in the Navajo Nation, Laguna Pueblo in New Mexico. The unfortunate historical impact of this legacy of uranium mining is that many of these contaminated areas in the Southwest have not been cleaned up. Sharing my screen here, as you can see, this is the Four Corners region of the United States. All these indicators on the map, the purple dots, the red dots, indicate unreclaimed mines in the area of New Mexico. The blue squares are mills utilized in the processing of uranium, the blue squares, which have also have experienced limited reclamation. This circled area is what is known as the Grants Mining District. This area was the most intensely mined area in North America during the years of late 1940s through the mid 1980s. Okay. And again, I'm not going to spend much time on the geography, but these red dots are represent unreclaimed, undecommissioned uranium mines and mills on the Navajo Nation, existing at about 500 abandoned mine sites. Yes, please.
Yeah, well, just letting you know that your screen share is not working, so folks are not seeing the images that you're referring to. Sorry to interrupt.
Okay, thank you for letting me know. I will get back to just my oral presentation. I thought this, I apologize to Chris. I had other commitments yesterday and was unable to get these slides to you. But getting back to the subject matter at hand, as I was saying, these impacts to the Navajo Nation as a result of unreclaimed mines contribute to the underlying health conditions that have been a major contributing health factor to the number of infections and deaths on the Navajo Nation. As of Wednesday, 3,204 infections and 102 deaths. In New Mexico, the small populated pueblos of Zia Pueblo, San Felipe Pueblo, and Zuni Pueblo have also been disproportionately impacted per capita. These pueblos, Zia has a population of probably less than 1,500 people with over 25 infections. San Felipe, which is a population of probably about 4,000 to 5,000 people, has 24 infections. Zuni Pueblo, which has a population of about 10,000 people, has about 30 infections. Contributing to these factors in correlation to extractive industries, as we all know, are the pre-existing conditions that we have as Indigenous peoples: diabetes, cancer, respiratory ailments, high blood pressure, diabetes, right, are found in all populations throughout Indigenous nations and communities. The limited access to healthcare, poverty, geographical isolation. On the Navajo Nation, there are only 13 supermarkets in a geographical area that is about the size of Ireland or the state of West Virginia. The limited infrastructure regarding healthcare facilitation, hospitals, Indian Health Service units, which are only about 5 to 6 service units on the Navajo Nation, serving a population of about 150,000 tribal members. So in that regard, when you think about the impacts to the Navajo Nation, and when you consider the population that lives in close proximity to these abandoned mine sites, abandoned mill sites, where documentation research has currently is currently being conducted in different geographical areas of the Navajo Nation in what is known as the Navajo Birth Cohort Study. This has been a work in progress since 2012, working with numerous institutions involved in the study: the University of New Mexico, Southwest Research and Information Center in Albuquerque, New Mexico, the Center for Disease Control, the Agency for Toxics and Substance Disease Registry, the Indian Health Service, the United States Environmental Protection Agency, Region 9, numerous health and environmental organizations within the Navajo Nation have also contributed to this birth cohort study. Its importance is that it is one of the first comprehensive studies in the United States where the correlation with environmental contamination along with a lack of reclamation have contributed to these enormous population impacts in Indian country throughout the Southwest. Some of the underlying health conditions as a result of living in these contaminated communities are increased incidence of cancer, all forms of cancer, from cancer of the brain to cancer of the colon and everything else in between, renal failure, kidney damage. These radioactive contaminants, radionuclides, disproportionately impact the kidneys, bone damage, numbness of vital joints, organ blockage, or oxygen blockage, excuse me, bladder infections, physical deformities and impacts in children. So in the time that I have, I would just like to emphasize some of the outcomes of these of the Navajo Birth Cohort Study, and this was done through methodology by radon, monitoring radon in homes, monitoring uranium decay products in residences that are in close proximity to these contaminated areas, water contamination, both surface and subsurface, monitoring food security in domesticated livestock as well as wild animals, who also rely on many of the same drinking water sources as the impacted human populations in close proximity to these sites. In the Navajo Birth Cohort Study, it consisted of 585 mothers and children. Participants were between the ages of 14 and 45 years old. 7% of the population lived in close proximity to these contaminated sites. Some of the outcomes of the study regarding, and this didn't only, part of the study group was not just mothers and infants, but the families as well. The father was also included. Urine and blood samples were taken from the 585 participants. Some of the results from the urine analysis indicate that at birth, or 17, excuse me, let me backtrack. 17% of the participants have urine concentrations in them greater than the US population. 3 of 20 Navajo tribal members have elevated concentrations of these contaminants in their urine compared to 1 in 30 in the US population. We find that in mothers, 16% of the mothers had elevated urine levels who participated in the study. Fathers had 27% elevated levels. The babies right at birth were determined to have 0.7 background levels of urine in the sampling. By 6 months, that would increase to 10.9%, and by one year, 38%. So living in the contaminated areas, the pathogens spread through dust particle contamination, wind-blown contaminants. We know in the American Southwest, sometimes wind levels can exceed 60, 70 miles per hour. We also see that seepage into the groundwater, as I said, surface water contamination, right? Some of these abandoned mines have been here on the Navajo Nation for over 70 years. Right in the middle of the contamination plume is also situated the Hopi Nation. At Acoma Pueblo, where I live, our neighboring Pueblo, Laguna Pueblo, housed for 30 years from 1982 to 1992 the Jackpile mine, which grew to be the largest open pit uranium mine in the world. And right now, Laguna and Acoma Pueblo are currently petitioning the federal government for a comprehensive health study among tribal members, similar to the Navajo birth cohort study that has just been conducted on the Navajo Nation. In the limited time that I have left, I would just also like to emphasize that the fight hasn't ended, you know, in this battle against the nuclear industry. Currently, the Trump administration is trying to revitalize the industry. In Arizona, we're concerned because one of those focal points of development is in the Coconino National Forest, particularly in close proximity to the Grand Canyon. And it's, you know, continually blows my mind why anyone in their right mind would want to situate a uranium mine in close proximity to one of the 7 natural wonders of the world, especially when all the evidence is right in the backyard of the Navajo Nation, you know, when these 500 abandoned mines and mills have not been cleaned up. And we know what flows right through the middle of the Grand Canyon, the Colorado River, right, which is the main domestic drinking water source for numerous western states in the upper and lower Colorado River basins. I know I'm running out of time, but I think some of these impacts that have been documented in this study, and I will share it with Southwest Research and Information. I will share this with the International Indian Treaty Council. The Southwest Research and Information Center out of Albuquerque, New Mexico, has made this data available on their website. You can access a lot of the information that I have cited at sric.org. In conclusion, I'd just like to say that the federal government has ignored our pleas for comprehensive health studies, reclamation, addressing a lack of infrastructure that currently exists in isolated geographical areas of the Navajo Nation, contributing to this high incidence rate of COVID-19 infections and deaths on the Navajo Nation, is a lack of infrastructure. Despite the fact that through uranium development, nuclear development, coal, and other fossil fuels, oil and natural gas, the Navajo Nation has contributed tremendously to the energy needs of the Western United States. Meanwhile, only over 17% of the Navajo Nation tribal members currently don't have running water, electricity, broadband internet, telephones in their residences. So this CARES Act that was passed by Congress, again, you know, we had to wait over 4 months before any money was actually realized in tribal communities. And, you know, as Andrea Carmen introduced in her comments regarding situations in Mexico, which are impacting the Yaqui Nation, are very similar to what's happening on Navajo and Pueblo lands in New Mexico, as well as other geographical areas. I know Mr. Iron Eyes is probably well aware of the abandoned mines and mills in western South Dakota, bordering the Pine Ridge and Cheyenne River reservations, impacting major tributaries and surface water in those areas of the Great Plains. And as Ms. Carmen said earlier, I think we can take this application even beyond environmental violence. These are examples of environmental genocide. And the ignoration of this government for over 70 plus years in these contaminated communities and nations is a definite breach of the trust relationship that exists between the United States government and Indian nations of the United States. Thank you for listening to me, and thank you for your time. Thank you.
Thank you very much, Manny. I'd like to move right to our final, last but not least speaker, Rochelle Diver from the Lake Superior Ojibwe. She's the Environmental Health Program Coordinator for the International Indian Treaty Council. You have the floor.
Miigwech Roberto. Minogi Gizevin, good morning to everybody. Small disclaimer before I get going, I know that we are running out of time. I want to thank you all for sticking with us for an hour and a half. And I know Zoom exhaustion is a real thing, so we really appreciate you staying here. To allow a few minutes for questions from our participants, which we already have some coming in, I'm just going to go ahead and give a really quick overview, just a couple bullet points of my presentation. Then my email and the text of my presentation can be shared on the IITC website, and I will join Lucy and other speakers next week for the Women and Girls webinar instead, so I can give you a full presentation there, which is also very appropriate as women, children, and future generations are greatly impacted by the environmental toxics and definitely deserve their own time and space to be discussed. So very quickly, I just want to share, Chris, could you please share my second slide? Thank you very much. I think this is really important for people to see. You'll be able to find this slide in the link on the website. So this is a US protest law tracker. As we are fighting for our rights to keep our lands, waters, air, and food clean of environmental toxics, different states around the United States are quietly enacting laws that will prevent us for advocating for ourselves, our peoples, and our nations. So I wanted to point you to this website because it updates itself in real time. And this is one way that we can find out about these harmful policies that are being pushed through during this pandemic that will impact our rights later that sometimes we don't know anything about. So this is a way that we can keep on it and see how we can get involved before this has gone too far for us to undo the impacts of these laws. So thank you, Chris, and please go ahead and go to my next slide. I just quickly want to talk about the agrochemicals that are being pushed onto our communities right now. BASF company out of Germany that basically swallowed up Monsanto and Bayer has created a new super chemical. I think that many people have heard of glyphosate and dicamba. Well, those are highly dangerous chemicals, and people are starting to understand the severe impacts that are caused by them. So regulations are starting to slow and lawsuits are starting to emerge. So what BASF has done is create a new super toxic by combining those two chemicals into a new pesticide or persistent organic pollutant. I just wanted to bring everyone's attention to this. Before we knew it was even created, it has already been approved to be used in 25 out of the 50 states in the United States. I'll be sure to follow up with some more information on this in the next week's webinar. And this picture that is shown here is on my nation, Fond du Lac Band of Lake Superior, Chippewa. We are currently fighting the polymet mine. My nation has a lawsuit trying to protect the boundary waters in northern Minnesota on the border of Canada. And this photo shows exactly what we are trying to protect. I will provide more information on how you can help stop the polymet mine and join our fight. With that, I will quickly say Chimigwich to everybody. Thank you for all that who've joined us. Be safe, and let's keep up the fight, everybody. Miigwech.
Thank you very much, Rochelle. As indicated, we will be having an additional webinar next week, next Friday, the same time. So please check the IITC website for the information on the speakers and the subject matter. And also you will be able to contact any of the speakers from today directly. Unfortunately, we don't have any more time to take questions. We have copied some questions, but because we don't have folks' email, it'd be hard to send you some responses. So if you go to that IITC website, I did put the link in the chat box. You'll be able to see the page. It's the online trainings page. There you'll be able to connect with each of the presenters from today to ask them your specific question on their presentation, or even broader questions you can direct to IITC at communications at Treaty Council. So with that, I want to thank, Hahom Itunokena Datiaono. Thank you, my sisters and brothers, for all the excellent presentations today, for sharing this great information. And we will come back next week. Again, we apologize, there's no time for questions, but we will come back again next week. You'll see some of the speakers again. And before we sign off, we want to just thank our translators, Rebecca and Daniel, for doing such a great job, and our behind the scenes tech, Chris, Amy, and everyone at IITC, who was able to help us get this educational, important, informative webinar out to everyone. We hope that we'll be able to share a recording of the webinar for those who didn't make it, but we'll let you know. Thank you very much. Say Hahom. Once again, thank you. This is Roberto Borrero, and we're signing off now.